Good morning, everyone, and thank you for joining us today for a virtual roundtable on Trump's failures to curb skyrocketing prescription drug prices. My name is BJ McAllister, and I'm the Deputy State Director for Biden for President in Maine. Joining us today for this roundtable discussion is State Representative Michael Brennan of Portland, Dr. Deb Patton of Bath, and Dr. Jeffrey Graham of Glenburn. Representative Brennan serves on the Maine House of Representatives, and he serves on the Joint Standing Committee on Health Coverage, Insurance, and Financial Services. Dr. Deb Patton is a physician who practiced medicine for 40 years in Maine. She lives and practices in Bath. And Dr. Jeffrey Graham is a physician who lives in Glenburn. Please join me in welcoming State Representative Dr. Brennan, Dr. Deb Patton, Dr. Jeffrey Graham. Over the last 4 years, Donald Trump has claimed over and over again that his administration is curbing prescription drug prices. At the first presidential debate in September, he claimed that he lowered drug costs by 80 or 90%, and the cost of life-saving insulin for diabetes was now, quote, like water. Let's be clear, these are flat out lies. The reality is that during the Trump presidency, the cost of prescription drugs has increased faster than any other commodity in the country. In 2018 alone, drug prices grew at twice the rate of inflation. And even in the midst of a pandemic that's still raging across the country, drug costs have continued to rise. These massive price increases are not happening in spite of Trump. They're happening because of Donald Trump. Instead of fighting prescription drug companies tooth and nail, he has repeatedly caved to Big Pharma, even though he made campaign promises to oppose them. Despite his promises, he opted to not have the federal government negotiate with pharmaceutical companies for lower drug prices. Despite his promises, he abandoned an effort to require pharmaceutical companies to pass discounts down to consumers. And despite his promises, when congressional Democrats attempted to work with the White House to pass legislation that would lower prescription drug costs, Trump opposed those efforts and threatened to veto a bill if it reached his desk. Instead, Trump has taken a series of toothless actions, including signing an order he claimed that would, quote, dramatically reduce the cost of prescription drugs, but proved to be largely symbolic. Over the last 4 years, he's formed no plan to reduce prescription drug costs as dramatically as he claims. Not only has Donald Trump broken his promises to curb the cost of prescription drugs, but he's actively attempting to make the problem worse. The Trump administration is currently in court suing to overturn the Affordable Care Act. The case will be heard by the Supreme Court the week after the election. And the administration's case is successful, drug prices will continue to go up more. Many older Americans will have to pay as much as $2,000 or more per year for prescription drugs if the ACA is overturned. That's because the ACA requires pharmaceutical companies to extend discounts to millions of Americans who often pay more for their prescription drugs after they reach a limit of what their Medicare plan will cover. If the ACA is overturned, those discounts will vanish and hike prices on older Mainers who rely on prescription drugs to survive. Even so, Trump continues to push to permanently dismantle the ACA, even though he's repeatedly promised better, cheaper healthcare. He's provided no alternative plan to replace it. While Trump continues to do worse than nothing by raising costs of prescription drugs, his friends at the pharmaceutical industry are doing better than ever before. Meanwhile, more and more Mainers and Americans are having difficulty affording life-saving medications, all while a global pandemic rages. Our guests today are three people who can speak to how devastating rising drug costs have been for Mainers and what Democrats in the Maine legislature have done to respond. I'd like to turn to two physicians who have a long history of practicing medicine in Maine. They can tell us how their patients have been affected by skyrocketing price of prescription drugs and how important it is that we elect leaders who actually make progress on reducing drug costs. First, I'd like to welcome Dr. Deb Patton of Bath. Dr. Patton, please tell us your story about how patients have been affected by skyrocketing prices of prescription drugs.
Hi, good morning, and thank you for having me. Can you hear me okay? Great.
Yes, we can hear you loud and clear.
Okay, good, probably too loudly. I feel like I have a lot I want to say. So thank you for having me. I'm a Maine native. I was born in Maine, raised in Maine, and after training in Boston and practicing there, I returned to Maine to practice primary care pediatrics and have recently retired after almost 40 years. I saw increasing numbers of families who were strapped for money and therefore delayed and forewent medical visits and prescriptions. Obviously, those can have very serious consequences. I saw people sharing prescriptions. Boy, I can't afford to get an inhaler for my teenager. Why don't you share mine? You're having a tough time. Let's open the medicine cabinet and see if there's something in there for your anxiety or depression. I saw people taking half the dose that was prescribed or only part of the dose that's prescribed. And obviously dosing is done for a reason, and diminished dose is going to be ineffective. Teenagers sharing a pack of birth control pills so that they didn't have to pay $30, $40, $50 a month for the next pack. Obviously, the cases go on, but when it comes to expensive medicines, foregoing them, delaying them, sharing them, diminishing the dose can have pretty bad consequences. I remember the case of a delightful, hardworking couple who had a very high deductible. And when they were in the office with their teenager who was having trouble breathing, having some bad asthma episodes, argued with me politely and very honestly about whether or not she really needed to have an inhaler at home because it was expensive and they'd already been paying a lot out of pocket that year. I really appreciated their being straightforward with me. And I think that this type of thing happens more often than we know, because I think a lot of these families remain invisible to us. They may be embarrassed or ashamed to say that they were sick for longer than they mentioned or shared a prescription. At any rate, the costs of prescriptions, which have gone up and up and up, I find to be arbitrary, increasing all the time, and inflated. There's a profit motive for the pharmaceutical company. And there are many reasons that the prices go up. You look at the salaries of the CEOs of the pharmaceutical companies. You look at the gazillion-dollar ads on TV for medications, and the advertising budget is greater than the research budget. And also there's a lot of salaries involved besides the CEOs of these pharmaceutical companies. Many people may not know that insurance companies and pharmaceutical companies get into these pacts with each other to determine which drugs will cost how much. They have different tiers. They have a preferred drug, and that's going to be the one that's $40 a month. They have a second level drug. That's the one that's going to be $70 a month. Then they have the non-preferred drugs, and that'll be $250 a month. What is not known is that this is fairly arbitrary. The same inhaler that may cost $30 a month on December 31st, come the first of the year, the next day, that inhaler may be $220 a month. So again, the pricing can be pretty arbitrary, and providers and their office staff may spend a lot of time on the phone talking with insurance/pharmaceutical companies about why they can't cover the cost of the prescription that the provider is recommending. So there's a lot of salaries that are covered by these increase in prices. At any rate, things are worsening and definitely have worsened with the current president in the last 4 years. And I feel that it's just not right for families to be in a make or break situation with their finances and their health because of this. So I appreciate your having me today.
Well, thank you, Dr. Patton, for sharing your story. And you highlighted a number of very important things. Mainers shouldn't be put in a situation where they have to spend their life savings on life-saving medication just to line the pockets of CEOs of pharmaceutical companies. I want people like Dr. Patton deciding which drug is the right drug for me to take. So thanks for sharing your story. Now I'd like to turn over to Dr. Jeffrey Graham of Glenburn. Dr. Graham, please share your story with us.
Yes, good morning. You hear me okay?
We can.
Wonderful. Great. Yes, I'm Dr. Jeff Graham. I work actually up at C.A. Dean Hospital in Greenville, Maine as a consulting urologist. I'd also like to mention something I'm very proud of, being a charter member here in Bangor of Maine All Care, supporting healthcare for all. Even though I'm not in the trenches like the primary care doctors or pediatricians, I have experience with the problems patients have with inflated drug prices. I often have to prescribe the medicine a patient can afford, not the one that I would deem most effective in that patient. This administration has continued to block the ability of government programs like Medicare and Medicaid from negotiating prescription drug prices, which Dr. Patton just mentioned. To date, only the VA can do this. Capping the price of individual medications like insulin seems only to happen at the state level, and I think we're going to hear more about that later, and that's a wonderful way of coming at this, but it's too bad we have to go at it that way. My daughter, who I spoke to just this morning as she was coming off her night shift, is an ICU nurse, and she wrote me and said, "Tell them insulin prices are ridiculous. My type 1 diabetic friends can't ration insulin and play rugby safely." So it was, again, hearing it from my patients and my family, but even age-old drugs are not immune to price gouging. If one company can become the sole producer, the antibiotic macrodantin, which was developed 2 years before I was born, and I'm not young, a couple of years ago, the price skyrocketed. One company apparently had taken over the majority of the production. They were able to do this. And so antibiotic that had been around for over 60 years, now we were getting calls about saying, "I'm sorry, I can't afford to take that one." And I thought, generic medication over 60 years old, I would not have a problem. But people worry that research into new medications will suffer if drug prices are negotiated and reduced. In answer to that, pharmaceutical companies spend 2 to 3 times as much on advertising as on research and development. Only 2 countries in the world allow advertising of prescription medication to the public. Surprisingly, New Zealand does, although I suspect they probably have more restrictions than we do. But basically, we're one of 2. Eliminating that, if you do the math, could more than triple the research budget. In addition, many drugs are initially developed using taxpayer funds, say by the NIH, and then with an idea that's developed by that basic research, the pharmaceutical companies receive this research for free, but pay no dividends whatsoever back to the taxpayer while they profit from the sale of these drugs at whatever they decide to charge. Basically, these are the things that have infuriated me along the lines as far as our healthcare system and its approach towards the control of the cost of prescription medications. And once again, this administration has done absolutely nothing to correct any of these flaws. So anyhow, thank you again for inviting me today.
Thank you, Dr. Graham. And you're absolutely right. This administration has just failed on promise after promise, and their broken promises have only done 2 things. 1, make CEOs of drug companies richer, and 2, make the cost of medication more expensive for everyday Mainers. Now, in the absence of federal leadership, thankfully, Democrats in the Maine state legislature have taken a number of steps to curb the rising prices of prescription drugs this session. I want to bring on our next guest who has taken on a real leadership role on this. Representative Brennan, can you tell us about some of the work you and legislative Democrats have done on this important issue?
Well, thank you, BJ. I'm very happy to be here and to talk about this particular issue, and I'm glad to be on the same panel with Dr. Graham and Dr. Patton. Before I get into specific things that the legislature's done, I just want to mention, I live in a district in Portland that has a significant number of people who are older, that live in elderly housing complexes, and also people that benefit from the ACA and from Maine Care. So when I ran for the legislature in 2018, healthcare was a huge issue that was facing my district. And I purposely asked to be on the Health Coverage Committee because I was hopeful that the governor, legislative leadership, and we as a legislature could move forward to address this issue of access to health care as well as prescription drugs. We know that if, in fact, the Affordable Care Act goes away, if Vice President Biden does not become President Biden, there'll be close to 120,000 people in the state of Maine that will lose their access to health care. About 60,000 people in the state receive the Affordable Care Act. Another 60,000 people benefit from the Maine Care expansion. And one of the very first things that Janet Mills did as governor was introduce legislation, executive order, that allowed 60 to 80,000 people that previously had no access to health insurance to become part of the Maine Care program. And that's an incredible number of people in the state that depend on the ACA and Maine Care for access to health care and health insurance. And I'll also add as an aside, because of both the ACA and because of the Maine Care expansion, we've had a number of people that previously have suffered from opiate issues and other substance use and mental health issues that had no access to service. And the Maine Care expansion has allowed thousands of people in the state of Maine that have suffered from substance use issues to finally get service. And after this election, at the end of the year, this could all go away unless everybody goes to the polls and votes on November 3rd. So what I'd like to do is talk a little bit more specifically about what we've done in 2019 and 2020 to address some healthcare issues specifically related to prescription drugs. The very first thing, BJ, as you know, Speaker Gideon and President Jackson introduced LD1. And LD1 takes all the protections about pre-existing conditions and access to health insurance that's in the Affordable Care Act and puts those in state law. So if, in fact, the ACA were to go away for some reason, Maine people would be protected in terms of pre-existing conditions and some of the protections that are in the Affordable Care Act. So I'm glad that we're able to take that step and at least reassure people in the state of Maine that if something does derail the Affordable Care Act, we still are protecting people in the state for pre-existing conditions and other protections on the Affordable Care Act. The other thing that we did, and this has been an idea that has been around for a while, but we passed legislation to set up a drug reimportation program that will have to eventually be approved by the Department of Health, U.S. Department of Health and Human Services, but that will allow us to import drugs and pharmaceutical prescriptions and things, have those filled from other countries, which will drastically reduce the cost of pharmaceuticals and drug prices in the state of Maine. And I might add, BJ, that Maine has always been a leader in trying to reduce the cost of prescription drugs, all the way back to now Congressperson Pingree, who, when she was in the state Senate, introduced groundbreaking legislation that helped us look at issues like reimportation. So I'm glad that that's on the agenda and we're able to pass that. The second thing is that we increased, this is a little bit of a technical approach, but we increased the income guidelines for the Medicare Part B program. And as a result of that, there are more people in the state of Maine that are going to be eligible for drugs for Maine elderly, and a subsidy program for people that are older that need access to prescription drugs. So that was a very positive thing that the legislature did. We also, Speaker Gideon, as Dr. Graham alluded to a little bit earlier, she introduced legislation that we passed that puts a cap on the cost of insulin, so that people that need insulin, obviously it's a life-saving medical intervention, and people cannot go without having insulin. We've put a cost control on that within the state of Maine to make sure that people that need insulin have access to insulin. And what we also did was put into place a pharmaceutical board and commission that will now monitor the cost of pharmaceuticals in the state of Maine and that when we see situations like spikes in the cost of insulin, the legislature will be able to step in, address that issue, and modify those costs. So even though in the short run, that's not a direct benefit in prices, in the long run, it's going to have a substantial impact in making sure that we don't have spikes in drugs that are essential to people. The other big thing that we did, and this is kind of gets a little bit in the weeds and gets a little technical and kind of hard to explain, but we do have what is called pharmacy benefit managers. And those people negotiate drug prices with the pharmaceutical companies and then with people with drugstores, drug chains, and other people that use pharmaceuticals. Oftentimes, the pharmaceutical companies give rebates to those pharmaceutical benefit managers, and they do not pass those on to consumers. So we've now required in the state of Maine that those rebates that go to the pharmacy benefit managers have to be passed on to consumers. That will result in substantial savings to people across the state of Maine and their prescription drugs. We also have put in some transparency measures so that the work of pharmacy benefit managers will be more, again, transparent and more available to the public. The other issue I think that's important, it's not directly related to the cost of drugs, but it does have to do with access to drugs. And that's that we strengthened the telemarketing reimbursement and insurance and access through telemarketing. And that was a very, very important step to take, given the fact that we've had COVID-19, where so many people have now become reliant on having access to telemedication or teleconferencing with physicians, so they have access to care, even though they're not able to go to visit the physician or their specialty care in person. So it's important that we've clearly been able to provide reimbursement and to outline the reimbursement process for telemedication in the state of Maine. And lastly, one of the other pieces of legislation that we kind of got under the wire before we adjourned this session had to do with surprise medical billing. And oftentimes people go in for a procedure and they think it's covered by their insurance. And then several weeks or months later, they get a bill telling them that they owe hundreds, if not thousands of dollars for that medical procedure. And normally that occurs because people are referred out of network. And because they're out of network, their insurance company does not cover it at the full cost. What this does is prevent that type of surprise medical bills and allows people to be fully aware of whatever type of care that they're going to receive and make sure that they have the option of doing it within network so that they're fully reimbursed for that. So those were a number of the things, BJ, that we were able to do over the last year or two to address prescription drugs and protect people's access to care. And again, most importantly, through the ACA and through Maine Care expansion, hundreds of thousands, tens of thousands of people in the state of Maine have access to healthcare that they did not have prior to the Maine Care expansion. So I think that the governor, President Jackson, Speaker Gideon, and the Maine legislature deserve a lot of credit for taking this issue on and understanding the importance of healthcare, the importance of providing access, and the importance of reducing the cost of prescription drugs to people across the state of Maine. And I think people can look to Democrats to take strong action, to act on the promise to continue to provide health care for people and reduce the cost of prescription drugs.
That's right. And thank you, Representative Brennan, not only for joining us, but for your leadership on this issue. It's so great to have leaders like you and other Democrats across the state who have stepped up to fight for older Mainers and others who rely on prescription drugs for their livelihood. We need leadership like that in the White House. And I know this well, and you know this well. When we worked on passing those prescription drug bills, when we worked on passing those health reform bills, you were met by a fleet of lobbyists who came before your committee, well-paid lobbyists. And what we've seen in the Maine legislature under the leadership of Democrats, we were able to pass these reforms because people like you, Representative Brennan, and people like Democrats put those lobbyists aside and put the concerns of working Mainers first. We have not seen that from the White House. The White House has prioritized lobbyists and CEOs while the cost of prescription drugs and healthcare have skyrocketed for everyday Mainers, and it's unacceptable. And it underscores why it's important that we elect somebody like Joe Biden. So thank you, Representative Brennan. In addition to reducing prescription drug prices, we can count on Vice President Biden to build on the Affordable Care Act and make sure that every American has access to affordable health care. He will finally force drug companies to negotiate their prices with Medicare, and he will allow consumers to buy prescription drugs from other countries and improve the supply of generics, much like the bill that Representative Brennan mentioned that Democrats passed in the legislature. It is clear that in order to address the problem of skyrocketing drug prices and to ensure that Mainers and Americans can afford access to life-saving medication, we must defeat Donald Trump and send Joe Biden to the White House this November. Look, there are only 18 days until Election Day, and voting is already underway in Maine. Visit voteinmaine.com for a handy one-stop shop for all the ways you can cast your ballot this election: by mail, in person early at your town office, or in person on Election Day. But the important thing is to make a plan, to vote, and to stick to it. And if you'd like to help us defeat Donald Trump and elect Democrats up and down the ballot this November, visit maindems.org/volunteer to sign up to volunteer and figure out how you can get involved. That ends today's roundtable. Thank you so much for joining us, and thank you to everyone who's watching at home. Stay safe. 18 days to go. Let's win this thing.